Hello everyone, and welcome to our presentation on dry eye disease. If you've ever experienced persistent feelings of parched, gritty, or simply uncomfortable eyes, you're not alone. These sensations are often the telltale signs of dry eye. Today, we'll delve into what this common condition is, why it occurs, what it feels like, and most importantly, the wide range of modern treatments available to help you find significant relief and protect your precious vision. So, what exactly is dry eye disease? It's a very common medical condition where your eyes either don't produce enough tears, or the tears they do produce aren't of good enough quality. This leads to them evaporating too quickly from the surface of your eye. Ultimately, this results in a loss of balance in the delicate tear film that covers your eye, causing discomfort and potentially affecting how clearly you see. It's more than just dry eyes. It's a recognized disease requiring proper understanding and management. To truly understand dry eye, it helps to know how amazing your tears are. They are far more than just water. Tears form a sophisticated, protective film over your cornea, which is the clear, dome-shaped front surface of your eye. This tear film is absolutely essential for clear vision and constantly protecting your eye from irritants and infections. It's composed of three crucial layers, each with a specific and vital function. The oily layer, this outermost layer is produced by tiny glands in your eyelids called meibomian glands. Its main job is to seal the tear film, acting like a protective barrier that reduces tear evaporation, helping your tears stay on the eye's surface longer. The watery, aqueous layer, this is the middle and thickest layer, produced by your main tear glands, the lacrimal glands, located just above the outer corner of your eye. It provides the majority of the moisture, helping to wash away debris and delivering vital oxygen and nutrients to the eye's surface. The mucin layer, this innermost layer is produced by tiny cells on your eye's surface called goblet cells. Its purpose is to help the watery tears spread evenly and adhere to the eye's surface, ensuring comprehensive coverage and preventing dry spots. The symptoms of dry eye can vary widely, from mild annoyance to significant daily discomfort. Many people describe a persistent stinging, burning, or scratchy sensation in their eyes. You might feel as if there's something gritty in your eye, like sand or an eyelash, even when there isn't. Your eyes can appear red, and you might experience blurred vision, which often temporarily improves after blinking as tears momentarily spread. Increased sensitivity to light, or photophobia, is also common. Contact lens wearers often find difficulty or discomfort when wearing contact lenses. You might notice eye fatigue or a sensation of heaviness, especially after tasks like reading or prolonged screen time. Sometimes, you might even observe occasional stringy mucus in or around your eyes. And perhaps surprisingly, some people experience paradoxical excessive watering of the eyes. This is actually a reflex response to irritation from dryness, but these reflex tears often lack the necessary oils and mucus to properly lubricate the eye, so the relief is usually temporary. Dry eye can be triggered by a wide array of factors, which we can group into several categories. First, let's look at biological and age-related factors. Aging. As we get older, particularly after the age of 50, our tear production naturally tends to decrease. This is a significant reason why dry eye is more prevalent in older individuals. Hormonal shifts, fluctuations in hormones, common during pregnancy, with birth control use, or during menopause, can increase a woman's susceptibility to dry eye. The role of hormone replacement therapy, HRT, can be complex, influencing tear film stability depending on the specific type. Meibomian gland dysfunction, MGD. This is a leading cause of what's called evaporative dry eye. If the tiny oil glands in your eyelids, the meibomian glands, become clogged or don't produce enough high-quality oil, your tears can evaporate too rapidly, leaving your eyes unprotected. Eye surgery. Previous eye surgeries, including LASIK, can temporarily or, in some cases, chronically affect tear production or the sensation of corneal nerves, contributing to dry eye. Next, we have medical and medication-induced factors. Medical conditions. Certain systemic diseases can significantly impact tear production or quality. These include autoimmune diseases such as Sjogren's syndrome, rheumatoid arthritis, or lupus. Thyroid disorders and eyelid inflammation, known as blepharitis, which is an irritation or infection of the eyelids, can also be major contributors. Medications. It's important to be aware that numerous common medications can have dry eyes as a side effect. These include antihistamines, decongestants, antidepressants, certain blood pressure medications, and some acne medications. It's crucial to inform your eye doctor about all medications you are currently taking so they can conduct a comprehensive assessment. Our environment and daily habits also play a significant role. Let's look at environmental and behavioral factors. Environmental factors, being in dry, windy, or smoky environments, or prolonged exposure to air conditioning, heating, or ceiling fans, can significantly increase tear evaporation from your eye surface. Digital screen use, spending prolonged periods viewing computers, phones, or tablets is strongly associated with a reduced blink rate, sometimes up to 50% less. This drastically increases tear evaporation and dryness. A helpful tip is the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. Contact lens wear. Long-term use of contact lenses can sometimes contribute to or exacerbate dry eye symptoms. Psychological factors. Interestingly, conditions such as anxiety, depression, and chronic stress are increasingly recognized as potentially influencing how we perceive or how severe our chronic pain is, including the ocular discomfort associated with dry eye. The mind-body connection means emotional stress can affect nerve pathways involved in tear production or increase overall pain sensitivity, making dry eye symptoms feel more intense. Yes, definitively, dry eye is widely recognized as a disease, often called dry eye disease, DED, or dry eye syndrome, DES. It's a complex condition affecting the surface of the eye, involving multiple factors that disrupt the stability of your tear film and overall eye health. Current understanding highlights a loss of balance of the tear film. This disruption can lead to ocular symptoms, the very sensations of discomfort, burning, grittiness, and blurred vision we discussed. Tear film instability. Tears might break up too quickly or lack consistency, failing to properly protect the eye. Tear hyperosmolarity. Your tears can become excessively salty, which is irritating to the eye surface. Inflammation and damage to the eye's surface. Persistent irritation can lead to inflammation and damage to the delicate cells on the front of your eye over time. Neurosensory abnormalities. Issues with nerve function might also play a role in the sensation of dryness. If left unaddressed, dry eye can potentially worsen. It's often described as a chronic and progressive condition, meaning its severity can increase over time without appropriate management. Potential progression includes increased discomfort. What starts as irritation can escalate to constant, severe burning, stinging, and a persistent foreign body sensation, truly impacting your daily activities and concentration. Visual disturbances. Blurred vision may become more frequent or severe, affecting tasks like reading, computer use, or driving. Damage to the eye surface. Inadequate lubrication and ongoing inflammation can lead to corneal abrasions, tiny, painful scratches on the surface of your cornea. These are not only painful but can also create entry points for infections. Corneal ulcers. Untreated abrasions or infections can progress to corneal ulcers, open sores on the cornea. These are serious, can cause intense pain, and may lead to permanent vision loss if infected. Corneal scarring. Prolonged inflammation and recurrent damage can form opaque scar tissue on the cornea, permanently affecting vision by blocking light. Conjunctivitis. Persistent dryness and irritation can also lead to chronic inflammation of the conjunctiva, the clear membrane covering the white part of the eye. Increased risk of eye infections. Your tears contain natural antibacterial components. A compromised tear film weakens this protective barrier, making your eyes more vulnerable to bacterial or viral infections. Impact on quality of life. Severe dry eye can significantly limit social activities, outdoor enjoyment, and productivity at work or school. The constant discomfort can be mentally taxing, leading to anxiety and depression, which in turn can further aggravate dry eye symptoms. Difficulty with contact lenses. For those who wear contact lenses, severe dry eye can make lenses increasingly uncomfortable or impossible to wear, often necessitating a switch to glasses. Understanding how dry eye may interact with other common eye conditions is very important for your overall eye health. While dry eye does not directly cause these other issues, its presence can significantly influence their symptoms, how they are diagnosed, and particularly how effectively they can be treated. It creates a complex interplay that your eye doctor considers when developing your treatment plan. Let's clarify the relationship between dry eye and high eye pressure, or glaucoma. First, no direct causation. Dry eye itself does not cause high eye pressure, also known as ocular hypertension, or glaucoma, which is a disease that damages the optic nerve, often due to high eye pressure. High eye pressure relates to the internal fluid dynamics of your eye, while dry eye affects the eye's surface. However, there's a crucial treatment interaction. Many conventional glaucoma eye drops, particularly those containing preservatives like benzalkonium chloride, BAK, are known to be irritating and potentially toxic to the ocular surface with long-term use. This can significantly worsen existing dry eye or even induce new dry eye symptoms, creating a challenging cycle for patients. This discomfort can lead to potential for compliance issues. When glaucoma drops cause significant discomfort, individuals may be tempted to reduce or even discontinue their medication. This is a very serious concern for glaucoma management, as it carries a significant risk of irreversible vision loss if the pressure isn't controlled. Finally, diagnostic interference. Severe dry eye can sometimes interfere with the accurate measurement of eye pressure, called tonometry, during eye exams, making it harder for your doctor to get a precise reading. Now, let's look at the relationship between dry eye and cataracts. Again, no direct causation. Dry eye does not cause cataracts, which are a clouding of the eye's natural lens, nor do cataracts cause dry eye. Both are common age-related conditions, so they frequently coexist simply because they become more common as people get older. However, there's a significant impact on cataract surgery. Untreated dry eye can significantly affect the accuracy of measurements needed for the intraocular lens, IOL, implants that are placed during cataract surgery. An unstable tear film can lead to incorrect IOL power calculations and potentially suboptimal vision post-surgery. For this reason, your eye doctor will often emphasize optimizing dry eye management before cataract surgery to ensure the best possible visual outcome. Furthermore, post-operative exacerbation. Cataract surgery itself may temporarily worsen existing dry eye or induce new symptoms. This can be due to the surgical effects on corneal nerves, the eye being exposed during surgery, and the use of preservative-containing eye drops after the procedure. Therefore, managing dry eye both before and after surgery is often considered vital for patient comfort and achieving optimal visual outcomes. The good news is that dry eye is a manageable condition, and there are many effective approaches that can significantly improve your comfort and overall eye health. Treatment strategies are typically highly individualized, meaning what works best for one person might differ for another, depending on the underlying cause and severity of their symptoms. It is very important to work closely with an eye care professional, either an optometrist or an ophthalmologist, to determine the most appropriate and effective plan for you. We'll explore three main categories of treatment: medications, lifestyle adjustments, and in-office procedures/surgical interventions. While eye drops applied directly to the eye are a primary tool, medications for dry eye encompass a broader range of forms and actions. Our first line of defense is often over-the-counter, OTC, eye drops, commonly known as artificial tears. These are a frequent initial recommendation for mild to moderate dry eye. They work by lubricating and moisturizing the eye's surface, essentially helping to replenish the watery layer of your tear film and stabilize it. Some formulations even include lipids or oils to help reduce evaporation. Consideration for preservative-free, for frequent use, generally more than 4 to 6 times a day, or if you have sensitive eyes, preservative-free artificial tears are commonly suggested. These are often available in individual single-use vials or multi-dose bottles with special filters. Why preservative-free? Because the preservatives found in regular drops can sometimes irritate sensitive eyes over time, potentially worsening dry eye symptoms. We generally advise against using redness reliever drops for dry eye, as they can cause rebound redness and may actually worsen dryness in the long run. For more persistent dry eye symptoms or when inflammation is a key factor, your eye doctor may prescribe stronger, more targeted drops. Immunomodulators are a class of prescription eye drops that include medications like cyclosporin, Restasis, Sequa, and lifitegrast, Xiidra. These are powerful anti-inflammatory medications that work by suppressing specific immune responses that contribute to the inflammation on the eye's surface. Over time, this may allow your eyes to produce more and better quality natural tears. It's important to know that the full benefits of these drops may take weeks to months to be observed, so patience and consistent use are key. Corticosteroid eye drops are potent anti-inflammatory agents. They are sometimes used for short-term relief of acute, severe inflammation associated with dry eye. However, due to potential side effects like increased eye pressure or the formation of cataracts with prolonged use, their use is typically limited to a specific, shorter duration as determined by your doctor. A newer class of drops are tear evaporation modulators, such as perfluorohexyloctane, MeBO. These drops are primarily used for evaporative dry eye, often linked to MGD. They work by creating a protective layer on the tear film, which helps to inhibit tear evaporation, keeping the eye lubricated for longer. Beyond eye drops, medications for dry eye can also be taken orally or even delivered via a nasal spray. Oral medications are taken by mouth and exert systemic effects. Oral antibiotics, like low-dose doxycycline, may not just fight infection but also have anti-inflammatory effects that can improve the quality of oil produced by your meibomian glands. They are sometimes prescribed for chronic meibomian gland dysfunction, MGD, or ocular rosacea. Oral cholinergic agonists, such as pilocarpine, are primarily used for severe dry eye, especially in cases related to autoimmune conditions like Sjogren's syndrome. These medications work by stimulating both tear and saliva production. If your dry eye stems from a systemic autoimmune disease, medications prescribed by a rheumatologist to manage that underlying condition may also significantly alleviate your ocular symptoms. A newer and innovative option is nasal sprays, specifically varenicline, brand name Tervea. This nasal spray works by activating specific nerve pathways in the nose that can stimulate the eye to produce more of its own natural tears. This offers a great alternative for individuals who may have difficulty with applying eye drops or experience sensitivity to them. There are a few other forms of medication that can be very helpful for dry eye. Eye ointments/ocular inserts, topical. Ointments are thick, gel-like or petroleum jelly-like formulations that coat the eye, providing extended lubrication and helping to prevent tear evaporation. Because they typically cause significant temporary blurry vision, they are most often used at bedtime for severe dryness, providing overnight relief. Ocular inserts, such as Lacrosert, are small, dissolvable pellets that are placed into the lower eyelid sac. They work by slowly releasing lubricating ingredients onto the eye's surface over several hours, providing continuous lubrication throughout the day. Finally, nutritional supplements can play a supportive role. Omega-3 fatty acids, often sourced from fish oil or flaxseed oil, are taken as oral supplements. They are known for their anti-inflammatory properties, which can help reduce inflammation throughout the body, including in the meibomian glands. This may contribute to a more stable tear film and reduced evaporative dry eye. It's always a good idea to discuss the appropriate dosage with your healthcare professional. Making certain changes to your daily habits and environment can also significantly help manage dry eye symptoms and improving comfort. First, try avoiding excessively dry, windy, or smoky environments, as these can dramatically increase tear evaporation. Using a humidifier in your home or office, particularly during dry seasons or when air conditioning or heating is on, can add moisture to the air and reduce dryness. Make a conscious effort to blink more often, especially when concentrating on digital devices. Full blinking helps spread tears across the eye surface. Speaking of digital devices, remember that 20-20-20 rule: every 20 minutes, look at something 20 feet away for at least 20 seconds. This gives your eyes a break and encourages blinking. When outdoors, wearing wraparound sunglasses can help protect your eyes from wind, sun, and dry air, reducing evaporation. If you have meibomian gland dysfunction, MGD, or blepharitis, practicing good eyelid hygiene with warm compresses and gentle eyelid scrubs can be very beneficial for improving oil flow. And finally, staying well hydrated by consuming sufficient water throughout the day is often considered beneficial for overall bodily functions, including tear production. When conservative measures like drops and lifestyle adjustments aren't sufficient, your eye doctor might consider certain in-office procedures or even surgical interventions. These approaches often target specific underlying issues or enhance tear retention and are typically performed in a doctor's office or an outpatient surgical center. One common procedure is punctal occlusion. This involves inserting punctal plugs, which are tiny, sterile devices, often made of silicone or dissolvable collagen, into the puncta. These are the small drainage holes located in the inner corner of your eyelids. By blocking these drainage points, the plugs help keep your natural tears, and any artificial tears you use, on the eye's surface for a longer duration, significantly improving lubrication. The procedure is typically quick and simple. If punctal plugs are effective but repeatedly dislodge, punctal cautery is a more permanent procedure where heat is used to close the tear drainage ducts, providing long-term retention of tears. For those whose dry eye is primarily caused by meibomian gland dysfunction, MGD, there are several specialized procedures. Thermal pulsation systems, such as LipiFlow or TearCare, are devices that apply controlled heat and gentle massage to your eyelids. The goal is to melt and express any blockages in the meibomian glands, which can significantly improve the flow and quality of the protective oils in your tears. Intense pulsed light, IPL, therapy involves applying specific light pulses to the skin around the eyelids. This therapy is believed to reduce inflammation, improve the function of the meibomian glands, and address underlying issues related to MGD. Meibomian gland probing/expression is a procedure where a fine probe may be used to physically unblock stubborn obstructions within the glands, followed by manual expression to clear out the stagnant oil. For more severe dry eye cases, or when other treatments haven't been effective, additional interventions might be considered. Amniotic membrane grafts, such as Procra, are used particularly for severe cases involving corneal damage. A sterile membrane derived from the human placenta is gently placed on the eye. These membranes are thought to possess powerful healing and anti-inflammatory properties that can significantly support the eye's surface recovery. Eyelid surgery, specifically blepharoplasty or lid repair, is considered if dry eye is caused or worsened by eyelid abnormalities. For instance, if your eyelids are turning in or out, or not closing completely, surgical correction can dramatically improve symptoms by allowing the eyelids to properly protect the eye's surface. Salivary gland transplantation is a highly specialized and very rare major surgery. It's generally reserved for extremely severe, refractory dry eye cases, e.g., due to severe autoimmune disease, where the eye produces very few tears. This complex procedure involves transplanting a minor salivary gland to provide continuous moisture to the eye. For individuals who experience both dry eye and elevated eye pressure, ocular hypertension, but have no definitive diagnosis of glaucoma, meaning there's no optic nerve damage or visual field loss yet, the treatment strategy can be particularly nuanced. The approach aims to minimize complications and effectively manage both conditions. Observation versus treatment initiation. Unlike diagnosed glaucoma, where pressure-lowering treatment is almost always initiated immediately, individuals with ocular hypertension may initially be placed on careful observation. Your eye doctor will typically monitor your eye pressure regularly and assess other risk factors. If the risk of developing glaucoma is deemed low to moderate, monitoring may be preferred over immediate medication, potentially allowing you to avoid the dry eye side effects associated with some pressure-lowering drops. Prioritizing preservative-free, PF, pressure-lowering drops. If pressure-lowering drops are determined to be necessary, ophthalmologists often prioritize preservative-free formulations, for example, specific types of preservative-free latanoprost. This is crucial because it eliminates exposure to benzalkonium chloride, BAK, a common preservative known to be a major contributing factor to dry eye exacerbation. Choosing preservative-free drops can significantly help preserve your ocular surface health and maintain patient comfort. Continuing our discussion on managing dry eye with high eye pressure but no glaucoma. Emphasis on laser therapy. Selective laser trabeculoplasty, SLT for ocular hypertension with coexisting dry eye, SLT is often considered an appealing initial treatment option. This in-office laser procedure can effectively lower eye pressure by improving the eye's natural drainage system. A significant advantage is that it can often reduce or potentially eliminate the need for daily eye drops for a period, which directly bypasses the ocular surface irritation associated with drops, potentially leading to better dry eye management. Aggressive standalone dry eye management. Since the primary goal is not solely to tolerate glaucoma drops, your dry eye management can be pursued proactively and independently. This might involve the early initiation of prescription anti-inflammatory dry eye drops, diligent attention to meibomian gland dysfunction, MGD, with both in-office procedures and at-home care, and the consideration of punctal plugs. Flexibility in treatment choice. Your ophthalmologist typically has greater flexibility in selecting pressure-lowering agents. There's less immediate pressure to choose the most potent, but potentially more irritating, option if your optic nerve is healthy. This allows for choices that can be both effective for lowering eye pressure and gentle on your ocular surface, improving your comfort and compliance. In conclusion, understanding dry eye as a genuine medical condition, a disease, is the important first step toward finding lasting relief. We've explored everything from the delicate balance of your tears to recognizing the many factors that can contribute to symptoms. We've also covered a wide range of available approaches, from over-the-counter options and crucial lifestyle considerations to prescription medications, in-office procedures, and even surgical possibilities for severe cases. Crucially, we've highlighted the complex interaction of dry eye with other common eye conditions like high eye pressure and cataracts, underscoring the importance of a comprehensive and individualized approach to your eye health. For anyone experiencing persistent dry eye symptoms, we strongly recommend consulting with an eye care professional. Either an optometrist or an ophthalmologist. An eye care professional can accurately diagnose the specific type of dry eye you have, assess any related concerns, and develop a tailored treatment plan that can offer lasting comfort, assist in preventing disease progression, and ultimately contribute to the long-term protection of your vision. Remember, consistent management is often considered key to maintaining optimal eye comfort and visual function.